back to TV5 News at 9. Joining us this morning, a real treat, Dr. Omar Gayar from McLaren Proton Therapy Center. Thank you so much for being here. How are you, doctor?
Great. Thank you so much for having me today.
We're delighted that you're here. Thank you so much. Okay, so today we're talking all about treatments for cancers located in the central nervous system. So, doctor, first, explain to us what is proton therapy and what are some of the benefits compared to conventional radiation?
Sure. Proton therapy is a very unique type of radiation therapy that allows us to help target tumors a lot better and also limiting the spread of low dose that goes to surrounding structures and organs that are nearby to the tumor. This can help actually drastically reduce the risk of side effects and complications, and just makes radiation a lot more tolerable for patients in comparison to conventional radiation therapy.
Okay, interesting. So when we talk about the central nervous system, so what types of cancers are we talking about? And how can proton therapy actually be used to treat cancers located in that area?
So there's quite a few cancers and tumors that can actually develop along the spine or the brain, including ependymomas, all types of gliomas, astrocytomas, glioblastomas, or even bony tumors or base of skull tumors like chondromas or even meningiomas. All sorts of things that are just aligned by critical structures within the brain, brainstem, spinal cord, and basically treating those with protons, we can actually help to significantly protect those structures that can be very sensitive to radiation therapy, and just make the whole process a lot more tolerable, as mentioned, and reduce the risk of any complications for patients.
Well, I'm sure, doctor, you've piqued so many people's interest about this now. So how can they find out if proton therapy is the best treatment for them?
Absolutely. I mean, they could always visit us at mclaren.org/proton treatment, or call us at 855-697-7686. That's 855-MY-PROTON. You can speak to one of our patient navigators and set them up with a patient, an appointment to see one of the radiation oncologists within our group, and be happy to go over their case and go over treatment options for them as well.
Awesome. Doctor, is there anything we haven't covered that you want to let people know about proton therapy?
We'd be happy to talk to you and see if your case would be a great case for proton beam therapy, and there's plenty of other tumors, central nervous system or otherwise, that we can absolutely help treat patients with. So we're happy to help patients get through their process in the best way possible.
I love it. Just give you a call and you can have all your questions answered. Thank you, doctor, for calling in today. We appreciate it.
Thank you.
Of course, you're welcome. And you can find out more information in the hot link section at WNEM.com.